is just a huge honor for me today to be podcast interviewing Dr. Willey, all the way from Peoria, Illinois. He's the founder of the Koala Sleep. He's got a dozen locations. He's done 3,000 of these sleep apnea appliances. Let me read his bio. He's developer and CEO of Koala Centers for Sleep Disorders, developer and founder of the Illinois Institute of Dental Sleep Medicine, Koala affiliate offices in Dunlap and Galesburg, Illinois locations providing oral appliance therapy for patients suffering with obstructive sleep apnea and TMD. He developed and instituted a unique treatment protocol for treating OSA, obstructive sleep apnea, and TMD, temporomandibular disorders, in the dental office. He's the CEO and owner of Maple Shade Dental Group for 25 years, a multi-specialty practice serving a patient base of 30,000, employing 7 dentists and 72 staff. Owner and developer of Embassy Dental Laboratory, a full-service dental lab providing in-house services as well as services for local dentists. National speaker and educator for dental sleep apnea and a medical model. He's had postdoctoral training in orthodontics, United States Dental Institute, completing a 5-year orthodontic course for general dentists, neuromuscular dentistry, the Las Vegas Institute for Advanced Dental Studies, neuromuscular implants, practical occlusion for the Progressive Practice Mastering Neuromuscular Occlusion. Dr. Wiley is a diplomate with the Academy of Clinical Sleep Disorder Disciplines, a diplomate of the American Sleeping and Breathing Academy, and serves on the board of directors for the dental division of the American Sleep and Breathing Academy. He has dedicated his practice to treating sleep disordered breathing, snoring, obstructive sleep apnea, and oral facial pain, TMD. His career path has taken him from general dentistry to the study of functional orthodontics at the United States Dental Institute, to neuromuscular occlusion from the prestigious Las Vegas Institute for Advanced Dental Studies, to treatment of obstructive sleep apnea with oral appliance therapy. All of these areas deal significantly with the neuromuscular positioning of the lower jaw and have proven to be a natural progression in the postgraduate studies. He is the founder and developer of the Koala Center for Sleep Disorders and follows strict medical and dental guidelines for treatment and medical insurance reimbursement for patients. Dr. Wiley is a national speaker for conventions and workshops with colleagues and students, and you're a member of just about anything you can think of. I won't read that list, or that'll take up the whole hour. So tell me this, we're podcasting, and most podcasters are young. Millennials do that. Old guys like us read books and go to conventions, and these kids, they're on their iPhone, their iPad, they're probably listening to you on their commute to work, on their treadmill. Go back in the day. How did you go from doing root canals, fillings, and crowns to sleep?
Yeah, that was quite an interesting transition in my life. I mean, I ate, lived, and breathed dentistry when I got out of dental school. As soon as I got out, I joined a course and started focusing on pediatric development and functional orthodontics, and started implementing that in my office. Loved it. I went to Loma Linda University to dental school, and when I got out, I felt as though there was really, I had an answer. It might not have been exactly how it would be done, and I've changed the methods a bit as I've gone along, but Loma Linda did a very good job of educating us in such a way that we could actually get it done and at least have an answer to most things in dentistry. So I really focused on that. I really enjoyed dental school, loved Loma Linda University, and yet I wasn't done with my education. I went in and did the orthodontics that moved me into the LVI like we talked about. And through the years, the next 15 years, I really honed my practice, grew my practice from 2 employees to a whole lot of employees and a whole lot of patients. Was just loving dentistry. One of my employees that had worked for me for some 15 years at this point, her and her husband became close friends of ours. He had a lot of perio issues, and I was seeing him every 3 months for perio, and had his mouth in tip-top condition. I remember Mike coming in, and I'd pat him on the back. Great, you're doing a good job, floss and brush, and teeth look awesome. Yeah, you're doing great. And all the while, I really didn't see an underlying problem that was going on. His wife would come to me and she would say, man, I know I'm yawning a lot today. I'm so tired. You know, Mike was snoring so much last night. I hardly got any sleep. He was a big guy, big neck, a little overweight, super jovial guy. And we just had all sorts of good times together. And she went home at the end of the day one day. Mike was a police officer here in town. He had worked the night shift the night before, and so he was sleeping during the day. And she came home after work and found him dead in bed from an apparent heart attack. Totally devastating, absolutely devastating to me as a person. And it was a severe tragedy in his middle 40s. Two young kids. You just could hardly, it was just one of those things that just really took my breath away. It was after that, about a year afterwards, I took my first course in dental sleep medicine. And as the speaker was talking about the big neck and, a person's probability of having sleep apnea and all the conditions were with it, the relationship with snoring and the relationship to the weight, overweight, and not sleeping well and all the things. And then he said a statement that really took my breath away. He said, 90% of people who die in their sleep due to a heart attack in their sleep, the root cause is sleep apnea. And it hit me like a ton of bricks. I realized right then and there that Mike would probably still be alive had I known then what I know now. But the truth of the matter is that the less we know about a condition, the more normal a person appears. Let me repeat that. The less we know about a condition, the more normal a person appears. He looked normal to me. I didn't realize that snoring was an abnormality. I thought it was just a nuisance. I knew he was a bit overweight, but who isn't, right? I knew he had a big neck, but hey, that was just Mike. Looks like a great deal. I had his teeth in tip-top shape. He was brush and floss and everything was doing great. And yet I didn't look beyond the teeth. I didn't hear a lot more about what went on with that seminar that first time. And it was all I could do to fight tears back in my eyes. And I realized and made a decision right then that there was never going to be another mouth that I looked down that I didn't look further than the back of the teeth. That I was going to assess obstructive sleep apnea on every single person, whether they're young or whether they're old, for the rest of my career. I came back and our practice was quite large at that time, and I started examining patients, and I found potential sleep apnea everywhere I looked. I couldn't believe the number of people that had this. In fact, it got to where it engulfed me so much that drill and fill just has never been the same again. I started treating this. I had 1 month where we did over 100 appliances in that single month. And the patients that were coming back, the response I was getting from them was incredible. For the first time in my life, I'd have patients coming and putting their arm around me and so thankful for giving them their life back. I'll tell you one quick story about one guy that was early on. The number of times a slow to stop breathing for this individual was 115 times per hour. That means he stopped breathing once every 30 seconds and for about a 10-second period of time or more. The poor guy could hardly keep his eyes open when he was talking to me. I spoke to him. I was actually at a Easter Seals conference for adults that have Down syndrome kids. It was a support group for Down syndrome put on by Easter Seals. They asked me to come and speak to them because most Down syndrome kids or adults have sleep apnea, big, thick neck, big tongue. And so I was explaining everything. He came to me afterwards. He said, this sounds like me, and told me a story. He was a Caterpillar executive. He was 51 years old at the time that this happened. He's got 8 kids. He had severe sleep apnea, knew it, tried a CPAP. CPAP wouldn't work. The gold standard for sleep apnea is to put something on your face that blows air down the throat and keeps the airways open, called the continuous positive airway pressure. It'll work 100% of the time on the 50% that can tolerate it. Unfortunately, he was part of that 50%. So he's ripping it off of his face, went back in and had the surgery done. Surgery where they call the UP3 surgery, taking the uvula out of the roof of the mouth or out of the soft palate, taking the soft tissues out of the pharyngeals and wedges out of the tongue. And that surgery only lasted for a very short period of time, and then it wasn't working anymore. His doctor told him all he could do was a trachea and recommended that he gets put on permanent disability. So that's when he found me. I got him the appliance, and drove him from 115 times an hour down to 31 times an hour with just an appliance. Still severe sleep apnea, way better than it was. He looked better. He drove himself to work that day. He had not even been able to drive because he fell asleep at a stoplight. So he drove himself to my office that day, I should say. We talked for a while, and after I got him adjusted, I arranged to have a sleep test done, and that's how I know it was at a 31. We then added a minimally invasive CPAP at a low pressure, reduced the pressure of that CPAP down from a 22, which is about to blow off the face, to an 11 that he could tolerate. Just the nasal pillows combined with the appliance, and it completely took him down. Here's the point that I'm trying to make. It was a year afterwards, 1 year follow-up, when he came into my office. And I looked at him, hey, you're doing great, everything looks great, and shook hands with him. I'm on my way out, glad you're doing so well. Looked like a completely different guy. He's a big guy. He says, hey, doc, and I turn around just as I'm walking out. He gets up out of the chair, and he looks down, puts his arm around me and looks down at me, and he says, just in case I was killed in a car accident, I just wanted to let you know, thank you for giving me my life back. Tears welling up in his eyes. I'm looking at him, and now I'm fighting back tears in mine. Are you kidding me? As a dentist, to impact people's lives to that level is absolutely incredible. What a privilege it is. Before I did this, I was making great smiles. I was impacting people's lives and the fact that we were helping them with their dental. But now I'm literally saving lives and giving people their lives back. What a time to be alive as a dentist. And for all you listeners that are out there, if you are, maybe you're at the beginning of your career, what a perfect time to be looking down the throat, evaluating these things so you don't have to have an experience like I did with my friend Mike that I could have done so much better with. Became the passion of my life. I sold my large practice. I started the Koala Center for Sleep Disorders. I began speaking to people, and I really completely believe in what we do. And now, whereas I'm just one location that I was able to help people with, now we've spread that out over many locations from coast to coast at this point, and almost coast to coast. And we are able to be saving people's lives throughout the country. Great time to be alive as a dentist.
Now you have 14 locations in 8 states?
Yes, that's correct.
Where we just
we have 2 in Phoenix, Arizona. That's the furthest west, although we're now just opening up into California. And so we'll be getting those here very soon.
Where in Cali are you going?
Well, we're just getting in. We got to register into the state, and we're in the process of getting that done. And we do have quite a few interests in Southern Cal that want to, and someone in Oakland as well. So we'll see how that goes, but we're going to be getting involved in that in the very near future. And then all the way into our latest one was in New York City, and he's 4 blocks from Times Square. So we have several in the rural places. We got probably 8 of them or 10 of them are in the Midwest. And then the rest of them are spread out. New Mexico, we got one in Albuquerque as well, and across the country.
Now, how do these work? Do you own these? Are they franchises, or how does the business model work?
Yeah, it works as a franchise. So the reason I did this is I was beginning to do some speaking and some national speaking, and when I was done, it was like deer in the headlights. Look, I had a lot of doctors coming up saying, how are you doing this? How are you getting patients? How are you getting paid? It seems like it's the same problem with all of us. How do you get the patients in the door? What process are you using to get them all the way through the process? And at the end of the day, how are you getting paid for it? And so as I was getting these questions and answering a lot of basic questions, I finally realized that the problem is there isn't a real good marketing program out there for people to come. They're all basically doing the same thing, trying to get patients from referrals from physicians, which is great, but that's just one of 15 different ways you can get patients. And everybody's focusing mainly on making sure they develop that. It's a good thing to develop, but there's a lot of other things that we can do out there. All the way to what systems are you using. If people are trying to do it inside their dental office and they're using dental software, this is a medical condition. we have to treat it as a medical condition, and we have to think like a physician. That means we got to have medical software that can handle this process, and we're able to write these things up and work the process as a physician would work the process in their office. There's a lot of guidelines and things that we have to do, laws that we have to obey. Because it's medicine, it's apples and oranges off of dentistry. So what we offer is a dental solution to a medical condition. But it is a medical condition. Being a medical condition, it runs through medical insurance, not dental insurance. And that's great. The insurance companies will say, oh yeah, we cover that, no problem, here it is. And then you submit, and if you don't have your ducks lined up, even though they'll cover it, they won't cover it because of some loophole in the process where you missed one of the things that you had to do along the way to get paid for it. So it's quite a difference from dentistry.
So do you have your own software, or what software do you use?
Yeah, so we are using a customized software that we have specifically for Koala. We took a large medical software that was customizable, and we were able to customize it into being what we would have for Koala. So the beauty of what we do is when we're going through and we're doing an initial exam, for instance, it's automatically going to generate a letter out that's with the specifics on that particular patient that we're able to send to the physicians. It has an auditing system, so we're able to, when we submit a claim, if the claim doesn't match up with what our electronic health record says, it's going to kick it out for us. So there's a lot of things that this integrated software does to help us to where we're able to streamline this and get it to the medical billing. We also have our own medical billing company that only works with Koala, but it's very focused. A lot of the things that I hear along the way is people saying, oh, I've tried these medical billing companies and they're terrible. Well, it's like a lab. If we have a dental lab and we send a bad impression into the dental lab and we're expecting to get a crown back that's going to be a perfect crown with great margins, the lab can only give you back a product as good as the impression is that you sent in. So if we don't send the correct things in to the billing company, they're not going to be able to get this process and get it out and the other side of it in any sort of timely fashion. It may not be the insurance company or the billing company's fault at all. It might be that the process didn't happen in such a way that it could smoothly run through.
I've been practicing in Phoenix for 29 years. You have two centers out here. You have one with my buddy Mark Castle and Jay Wright in Glendale, Arizona. Then you have another one with Beth Hammond and Shuri in Phoenix down there, kind of downtown 32nd Street. How many franchises can go into a major market?
Yeah, we have a protected territory. Now, of course, Phoenix is a lot of millions.
4 million. 4 million metro.
Yeah, metro in the metro area. And so we have a protected territory. I base that on population. So that population, I base it on population and area. So you're going to have a higher population in the Phoenix area, or certainly when you get into New York. I mean, you can have several 100,000 people in a couple of block area in New York City. So we do base it on area or region, so they're not next to each other, but we also base it on population. We're going to have anywhere, so the protected territory is from 250,000 up to about 500,000 people to have that in that particular area. We actually segment that out, and we'll spell out either by zip codes or by roads exactly what that protected territory means. And what that means is there's never going to be a koala within that protected territory. So in the Phoenix area, certainly there's room for some others, but at the same time, we want to make sure that the ones that are there have ample population to be able to make this. I believe that it's to have a good, solid, full-time sleep practice, you're going to need about 300,000, 250 to 300,000 to make that work. And here in Peoria, I'm basing that here in the Peoria area, we're about a metro population, about 250,000. And this is a full-time practice here. We've been able to do very well here.
Yeah, you should definitely put another one out in East Mesa, because just to go from downtown Phoenix, where Beth and Shari are, to go to the mall on Power Road in East Mesa would be a 1 hour drive.
Yeah. Yeah.
I mean, so I've done this several times in my life where I went to my aunt's house, and then when we were done, went to dinner at her friend's house, and one was down in the southwest Queen Creek, and the aunt was up in the northeast Sun City, and it was an hour and a half drive at 70 miles an hour.
Isn't that crazy?
I mean, it's a huge amount. So these guys own their own practice. They're licensed in Arizona. They're a full owner. They just bought the franchise of the system.
Yeah, so what we do, we don't dictate treatment. They are the dentist, and it is their business. What we provide is systems and support. Support and training, so they come back. We do a week-long training program. We do a 12-week pre-training program that happens, and there's a lot that happens during that time. And then they'll come in for a 1 week long training program in my office. Part of that time is didactics, learning the software and basic things about sleep apnea and temporomandibular joint disorder. Talk about that as well, but the training between the two. Then the other half of the time is spent actually with me, the doctor spending time with me. We're going around seeing actual patients, my patients, doing new patients, follow-ups, exams, deliveries, impressions, you name it. And by the time we're done with that week, you will have seen a lot of patients, and we will have addressed the majority of the issues that come along with the treatment of sleep apnea and temporomandibular joint disorder. So the office is there. They'll have their office staff here as well. The front desk is trained with our front desk. The assistants are trained with our assistants. And the treatment planner or project manager or office manager is trained with our office manager. And we implement the systems. So when they leave, there will be somebody that is proficient with every one of the systems along the way. So our program includes everything from the support, training, a complete marketing program. We'll sit down and actually put a marketing plan together and business plan together, and then as well as then ongoing support, auditing that goes on, making sure that things are being written down correctly, and of course then the billing process along the way.
How often do you get to Phoenix?
I'm actually going to be out there coming up, I think it's on the 9th, the 8th and the 9th. I get out there probably 4 times a year. The American Sleep and Breathing Academy has their national meeting out there in, I believe it's going to be April or May, usually each year. And I'm usually speaking out there for that. I'm going to be out there here on the Friday, I believe that is the 9th of December. Yeah.
Well, you know what would be just an epic blast is if you're down here, we should have my son Ryan film another podcast at the dining room table and bring Mark and Jay and Beth and Sheree and just have a round table talking about it.
Yeah, that'd be great. Let me see if I can get that done. Might be able to do it like on that Thursday night.
Yeah.
The night before.
Yeah.
Let me make some phone calls here. Let's see what we can do.
Mark Castle's been a mover and shaker for 30 years.
Yeah.
I mean, that guy's always at the front of the line. Wherever he's standing, he's at the front of the line. That guy's a mover and shaker. So let's go to an independent source. What does the Centers for Disease Control, say about sleep apnea? Because some dentists might be thinking, because some of the older dentists, I have to tell you, they've seen a lot of fads, whether it be air abrasion or lasers or this or that. And some I've heard older dentists on Dental Town say, I'm going to wait and see if this is a fad. What is an independent source like the Centers for Disease Control saying about sleep apnea?
This isn't going away. I was just coming back yesterday, as a matter of fact. I heard on the news that the train, and it was was back east, I think New Jersey. It was about a few months ago, and the train didn't stop at the end of the tracks, and a woman was killed. It just kept right on going, and they came in just yesterday. I heard on the way back that it was the final conclusion that the engineer fell asleep due to sleep apnea, and specifically sleep apnea. Now, here's the deal. Center for Disease and Control has estimated, depends on the numbers you're looking at, as many as 54 million people in this country with sleep apnea, 85% going undiagnosed. That's the new statistic.
54 million.
Here, yeah.
And the population's 322 million.
Yeah.
So that's about 1 in 6.
That's right. And why? Because of the obesity epidemic that's gone on in this country. Look at the CDC's map on obesity, and you can see where, and you might have seen that in the past, where 20 years ago it was like barely, not a lot of obesity on the map, and you can just see it filling in the map and getting more and more and more extreme to where now it's just like everywhere. It's incredible to watch.
How come when you said obesity, you looked at me? Oh,
hey,
come on. Come on, Rod. You just looked right at me when you said, yeah. What do you think's driving? I mean, so many people think they know it all, but when I talk to obesity experts, it's not so simple, black and white. I mean, there's a lot of theories on the obesity epidemic. I mean, what's your theory on the obesity epidemic? And by the way, we were always the most obese nation, but last year Mexico passed the United States in obesity.
Wow, I didn't know that one.
Yeah, they really? Absolutely passed us. And my my Mexican friends that are my age that grew up in Mexico City say they cannot believe it. They said when they were little, they thought they were all ideal weight because everybody walked around or this, that. But they said you go back to Mexico City, it's worse than going to Walmart in Phoenix.
Wow.
And wow. So does the United Nations, World Health Organization. So Mexico passes. So what do you think's driving it?
It's our lifestyle. It really is. I mean, years ago, we used to actually get out of our house and go out and do things. It seems like the more gadgets we get, the more we're sitting at the table, and we got to get things done fast. We are putting ourselves under so much pressure to do more and more things in a day's time that we're jumping into fast foods in a big way. We're not eating processed or natural foods the way we used to. So everything is about the fast food market, jumping in here, grabbing this on your way to work, and something else on your way home. A lot of our entertainment, we're going to go out and go out with friends. Where are we going? Oh, what restaurant do we want to go to? And of course, these restaurants, the better tasting they are, the worse they are for you, it seems. And so it really has to do with lifestyle and lack of physical exercise. It's basic. It's a basics of life. We got to exercise, and we got to eat.
And the portions are out of control. I mean, you go to a restaurant and you order just a salad, and it's like that's the size of the salad you'd put on the dinner table to feed the whole family. Yeah,
and let me tell you something else. Sleep apnea is a contributor to eating disorders. Here's how. If you have sleep apnea, when you're in your deep sleep, there's two hormones that are produced in that deep sleep. So let me go in and explain to your audience a little bit about what's causing the sleep apnea for some of you who may not understand. You go into the different levels of sleep, all the way from the twilight sleep, all the way down to your slow wave and REM sleep, where you're getting that deep sleep. When you're in the deep sleep, your muscle tone goes away. This is a sleep that's there like when you pick up the little child and he's loose he has no muscle tone. You can hardly pick him up because he's just limp as a noodle. We go through that as adults. We go in and out of that. When you come into that point where you're in that deep sleep, your muscle tone goes away, your jaw falls back, the sides of the throat cave in a little bit, the roof of the mouth drops down, the uvula starts flapping away, you get the snoring that's going on. If you don't get the elbow in the side of the ribs, then it can stop out, it can block out completely. When it blocks out completely, your brain has one of two choices: kick you out of the deep sleep or let you suffocate. That's it. The medulla, the brain center for breathing. It's going to kick you out of that deep sleep after you've stopped breathing for a 10-second period of time or more. Oxygen levels going down in the blood, carbon dioxide's building up, boom, it kicks in, and it kicks you out of that deep sleep. Here's the problem. Our body does a whole lot of things in deep sleep. One of those things is a couple of hormones that are produced in deep sleep, ghrelin and leptin. And if you don't get in that deep sleep, or you're not in it, you're constantly getting kicked out of it, then you're going to be depleted from the ghrelin and leptin. One causes.
What was the first one? You said leptin, and what was the other one?
Ghrelin. I think that's Grehlin, I believe is how that's spelled.
Okay.
To look at it, something like that. Might not be quite right on that spelling. So the ghrelin and leptin, here's the thing about that. If you're getting shorted on those two chemicals, then those two produce they're producing chemicals that allows you to feel full and satisfied. So when you're done eating, you feel satisfied, so you're not overeating. And the other stops you from craving starches and sweets. So if you're not getting in the deep sleep, it's setting you up for more weight gain because of the starches and sweets and overeating. And that weight gain then in turn is going to give you, put a little extra weight on there. That also, it's not only in the midsection where you're gaining the weight, it's also in the neck. The wider the neck, the narrower the airway. Fatty tissues builds up in the airway, narrows the airway. So that's why a person gains 20 pounds or snoring more than they did when they didn't have that weight. It is very true that you can have severe sleep apnea and be very thin. Okay, just saw somebody this morning, very, very thin. His sleep apnea is 60 times an hour. Okay, AHI, apnea hypopnea index. Number of times a slow to stop breathing, 60 times an hour. Guy was bone thin. No way he had a chance to lose any of that weight. There's none to lose. The only thing you can say is if he gained weight, it's going to get a lot worse. So the lack of ghrelin and leptin causes the body then to crave different things and overeat, gains more weight. The more weight you gain, the worse the apnea becomes, and it's a vicious circle. I had one nurse that we treated. She's tried she claims she's tried every diet under the sun. Couldn't lose weight for nothing. We got her diagnosed, has sleep apnea, got it treated, and she has lost almost 100 pounds since she got treated in less than a year. Makes a big difference. And if you have sleep apnea, a lot of times you can't lose that weight even if you try. You just can't keep it off. You get sleep apnea treated and it begins to fade out. A person with once they get their apnea treated, on the average, they'll have a weight loss. About 10% of their excess weight will be lost just by getting it treated. They're eating differently, they're exercising where they didn't before, they're set up now for weight loss.
Now, what are the AHI numbers you like to see? What is good?
Yeah.
Bad?
Yeah. Apnea hypopnea index, that's the number of times of slowed or stopped breathing. Apnea meaning without breath. It's when you stop breathing while you're asleep. Hypopnea, slowed breathing while you're sleeping. There's an index, meaning how many times do you have that apneic moment, a moment where you stop breathing like that, how many times per hour. So the way you find that out is by going and having a sleep test done, either in a sleep test or either in a sleep lab called a polysomnogram, a PSG, or possibly a home sleep test that's done at home. Either way, the numbers are scored and then evaluated by a board-certified sleep specialist. Even though I've got board certification, I'm a dentist, not a physician. It's against the Dental Practice Act to diagnose sleep apnea. You must be a physician. All you listeners out there, if anybody says, do you diagnose sleep apnea as a dentist? The answer is categorically no, we never do. We work with a person who has already been diagnosed with sleep apnea, and usually under the direction of a physician, giving an option, which is the alternative to the CPAP, an appliance that does very well.
And is that the Dental Practice Act for each of the 50 states, or is that a federal law for the country?
That is, I believe, a federal law. There is no place in the United States where you can diagnose sleep apnea as a dentist.
Has anybody thought about suing that or challenging that?
Boy, I don't know. That's a good question. I ought to ask the ASBA that question. The deal is a medical condition. Yeah.
Well, yeah. You remember the big Texas lawsuit where the Texas State, the Texas State Dental Association, tripartite of the American Dental Association, sued some guy for saying he was a specialist in implantology, and they said there is no specialty of that. And Texas Supreme Court said, well, who are you? You're a club. You don't have any authority. And so the whole specialty deal now is been thrown out the window. So I'm sure that same exact attorney who did that, I bet you he could file that a lawsuit against that Dental Practice Act, and they throw that out in a minute.
What they're stating is if we diagnose that, we're practicing medicine without a license. They're stating that this is not a dental condition, it is a medical condition, and therefore it has to be diagnosed as a medical condition and overseen as a medical condition. Now, it's a gray area about the overseeing part, and it's getting to be tighter and tighter and tighter that you got to have some medical oversight on this. So it depends on who you talk to at this point, quite honestly, as to where it's at. But a physician is not trained on these appliances. The appliances affect jaws, and in so doing, they're affecting occlusion. So we're going in and we're just throwing these things in. We're affecting jaws, affecting TMJ, and we're doing that without training in that. That's not a good deal. In fact, one seminar I sat down and the speaker started his seminar by stating, if you're treating sleep apnea and you're not treating TMJ, then that is like learning how to dive before you learn how to swim. If you're going to be treating sleep apnea, you will be treating temporomandibular joint disorder, period, because you're affecting it. Therefore, the physicians that are out there, and there are some ENTs now beginning to do a little of this, but they're running into problems because they have no education at all on occlusion and no way of understanding what to do with these cases once you get any sort of bite changes.
So give us the percentages of your Koala Sleep Center for Sleep Disorders. What percent of those patients go to a sleep lab versus take home a home test?
The home sleep testing has really come onto the market in the last few years, and it's getting to be higher and higher for the home sleep testing. A polysomnogram, a sleep lab test, is to the patient is going to be charged out somewhere $3,000. I've seen as high as $6,000. Are you kidding me? So just to get it diagnosed. A home sleep test on the average is about $300. So it's 10% of the cost of a sleep lab test. It's proven to be as accurate as a sleep lab test, the home sleep testing has been, not as comprehensive. So when you're in a sleep lab, they're going to evaluate staging of sleep, and they're going to evaluate restless leg syndrome, okay? They're going to evaluate things like sleep position and a lot of other things that goes on. With a home sleep test, they're going to evaluate whether or not you stop breathing or not, what your heart rate is, what your oxygen level is in the blood, what your sleep position is, if you're snoring or not, fragmented sleep. There's 12 different things in a home sleep test that is used to evaluate for sleep apnea. The same 12 things that you're evaluating for a sleep apnea in a sleep lab. But the sleep lab is also more comprehensive. It's giving us more details about central sleep apneas. It's going to give us ideas about restless leg syndrome. If you're having where you're stopping breathing, are you stopping breathing in REM sleep versus the slow wave sleep, or what level are you stopping breathing in? So it'll give you the basis, a little more depth. So it's more in depth, but it is not more accurate. Arguably, you're in your own bed, your own environment with a home test. You could arguably think that that is more accurate than a artificial place like a sleep lab with 1,000 wires hooked up to you, strange bed, strange environment, camera looking at you. They flip the light off and tell you to go to sleep, and you're like, yeah, like that's going to happen anytime soon. So, but it does give you accurate information. To answer your question, I'm going to give it about probably 60% home sleep testing is done in this day and age, but I have nothing to back that up other than my own experience on where it's at. Still a lot of sleep lab tests done.
But for your own Koala people, what do you think it is? 60-40?
I'm still going to say that's where I'm coming from, is about our...
And what's your favorite home sleep test device?
You know, I like the T3 Care Fusion system. You got to have a level 3 type of ones that's going to give you the channels and the 12 things that we need to measure. So you got to have more than just a simple pulse ox or some of these that are not as comprehensive. So it's got to be a type that is that we're able to diagnose sleep apnea with. But the Care Fusion T3 I believe is my favorite. There's a lot of different ones that are, the apnea link is probably the main one that the most of the physicians like to use. My problem with the apnea link is they don't show the sleep efficiency. And if you're not seeing the sleep efficiency, then you don't know how well they slept that night, and that can affect whether or not they got apneas that night. So if you're not getting a good quality of sleep, you may not be going into that deep sleep like you naturally would. Therefore, your apnea didn't show up that night where it naturally would. So I think sleep efficiency is a big thing to look at.
So you like the NOx-T3 portable sleep monitor?
T3. Mm-hmm.
And how much is something like that?
It's around $4,000.
And how many do you think a dentist has to own of these?
You know, I've got 5 of these units, but a lot of them will just take one. Now, here's the thing on the home sleep testing. This market has changed dramatically in the last few years. Home sleep testing is now being challenged. Medicare made a ruling a couple of years ago now that stated that a dentist is basically providing a piece of equipment that's a durable medical equipment. So here's my appliance. This is a Herbst appliance. There's a lot of these FDA-approved appliances that are out there. I don't know if you can see that. There we go. Get this up here where you can see it. And fits on the mouth like this, and fits in the upper arch, lower arch, custom made. And it simply stops the jaw from falling back, okay? They all work on the same premise, whether you have a TAP, a SomniMed, the Herbst, or any of the lookalikes of these things. There's a lot of different appliances that are out there on the market. But it's a medical device. Being a medical device, it has to have FDA approval. Beyond that, then Medicare took this one step further, as the Medicare loves to do. They try to complicate everything. And then they said, well, it also has to have a PDAC approval, a approval so it's approved by Medicare. With that being said, then you have to use a device that's approved by Medicare. Medicare has all sorts of guidelines that are out there. A couple of years ago, one of those things was they're saying, this is a piece of equipment. It falls under what's called durable medical equipment, a DME, okay? Just like a CPAP. Therefore, we have to be a licensed DME provider. And Medicare looks at us like you would someone who has a business selling crutches and or renting crutches and walkers and wheelchairs and everything else. It's a piece of equipment, but it has to be delivered by a licensed dentist. Got it. Okay. So unfortunately, that puts us in Medicare's eyes, we're the DME provider. As the DME provider, they then make a statement that we cannot have anything to do with even providing anything to do with diagnostics. The home sleep test is a diagnostic tool. Because it's a diagnostic tool, Medicare specifically spelled out the dentist that he cannot even provide the equipment for a patient to have the diagnostics done, because we are the DME. Since we're the DME, we can't have anything to do with the diagnostics. Unfortunately, a lot of your medical insurance companies are following Medicare guidelines. Therefore, United Healthcare and several of the others are now throwing this out as well, stating that the dentist can't have anything to do with it. So this is beginning, the home sleep testing market is beginning to get pulled away from the dentist because of that. So to answer your question, how many of these should you have? I would recommend everybody checks with their local state, find out what the legality of it is, and then find out where this is going. I hate to see anybody investing equipment. You can rent these. In fact, that's probably what I would recommend. Check it out, but rent them. You can rent them for less than $100 a month. And I would say go that route right now until this whole thing gets figured out. It's sitting here in a gray zone, and it's changing monthly. So that's one of those things I've got my ear to the ground with, along with others. And with the American Sleep and Breathing Academy, these are the types of items that we take up the banner on, and we begin to go to work and fight for these things on the dentist's behalf.
And I think that's why there was we just went through a a crazy presidential election,
Yeah.
and the country's virtually split in half. But one of the things that was Obamacare, you're just talking exactly what's going wrong with Obamacare, and the fact that it was so great and noble to get rid of pre-existing conditions, so literally 10 million people could get health insurance. And I had patients cry in my operatory because they own, husband and wife, they own their own business. They
Yeah.
both had bouts of diseases in the past, cancers. They hadn't had medical insurance for a decade. And then when Obamacare, the Affordable Health Care Act came, they got coverage.
Right.
But they didn't pass any legislation to get rid of cost. Nothing to make it faster, easier. And that's so typical government. They have a noble cause, but they're not business people.
And
They're all a bunch of lawyers, and lawyers do this. They just overcomplicate the crap out of everything. And if the Affordable Health Care Act would have spent twice as much time fighting cost and confusion, a lot of people, this is the first year that healthcare costs in America will go over $3 trillion and be 17% of the economy, which means 17 cents of every dollar goes to healthcare. And they still think 30% of the cost is shuffling the paper and the forms and the predeterminations and all that shit.
I was sitting by a physician on a flight here just recently, and he was a primary care physician, and he's thinking of getting out completely. He said, I can no longer do my work. Half my time is spent behind the stupid computer, typing everything out, getting everything ready because of all the complications and everything that's in there. That has to change. We can't continue doing that. And I'm so thankful to see at least some new thoughts and new blood and new ideas that are coming through. Now, where it goes, we need to have treatment. I mean, pre-existing conditions, people need to be able to get out there and have that. I completely agree with that. But as the government does, it can't do anything simply. It can make the simple complicated every time. So they put layers of paperwork and things that just muddles it all together and creates huge problems. So
and the young millennials are idealistic, but as you get older like us, it makes you remember what Ronald Reagan used to say: the government is the problem, they're not the solution. But so many young people think the government's going to fix everything, and they don't realize that the government screws everything up. Going back to the millennials, you're talking to a lot of kids right now, thousands of them that just graduated, and they're all, my job is to guess what they're saying, and they're all saying the same thing right now. They're screaming at the podcast saying, I just graduated from school, and guess how much sleep apnea they taught me? None. So they're all sitting here saying that every graduating class since the beginning of time has the same complaint. They didn't get to do any ortho. They didn't get to do any Invisalign. They didn't get to do hardly anything. They don't realize the genius task it was to take 100 kids off the street and turn them loose with a doctorate in dentistry. Okay, I would never want that task. But anyway, so starting here. So she's driving to work and she's saying, how do I learn more about sleep apnea? What would you tell her?
There is a lot of seminars that are out there that you can go, and they all are going to be basically giving the introduction, okay? So starting with the introduction on a weekend course is not bad. You can get those fairly inexpensively. You can get a lot on the things like this, the podcast. I'd be happy to come back in and do one that gives a complete basic full training specifically on sleep apnea. But there's things you can do that you can get in on that to that level to get it to get the basics on it. You have to be a little bit careful, and I would advise people to be a bit careful about the seminars and what their underlying motive is for that, because they're usually selling a piece of equipment or they're selling one of these things, and you got to be careful that you're not just getting sold a bill of goods. So if they're selling an appliance, they're going to tell you everything great about that appliance, but they may not tell you all the downsides of that particular appliance. Most of these appliances all have royalties on it. This particular one, the Herbst appliance, does not, but the majority of them do. And there's a lot of people going out there promoting inferior appliances, and they're doing it, because that's their business. And so we have to be careful whether they're selling equipment or they're selling appliances or selling software, that is taken as a grain of salt. All of it is going to be good, okay? But I would suggest that you did this. Get on the websites, the ASBA, the AADSM websites, basically those two, and learn the basics on these things. You can get on these and track these down without having to spend a lot of money doing that. So getting on the websites and going from there is a good first start. Beyond there, then deciding what courses you want to take on this stuff. Yes, it's going to be an investment. You're going to need to spend some time and some money on it, but it's well worth it in the end to be able to do so. But to get started, websites, inexpensive.
Now, what lab do you use? Because I noticed you are a member of the American Sleep Breathing Academy, which is also in my backyard. I'm in Phoenix, and that's in that's where's that out? Fountain Hills?
Yeah.
Scottsdale?
It's in Scottsdale.
Yeah. I'm too poor to drive to that part of town, but they let me go a couple blocks in. But there's also a huge lab out here, Gergen Ortho, David Gergen. Do you use his lab ever? Or?
We do. They actually have a second location here in my building. Don't have any ownership in it whatsoever or anything other than that they're using that. So I went to David a while back and I said, I need to have something closer to home, and I'm going to either develop something or we need to have you back here. And since I was one of their larger businesses, they elected to put one back here. So we actually have Gergen Lab is their second location. For the Midwest location is at my facility. So that's good, and they do a great job. With that, they make these Herbst appliances. They'll make several of the others that are there, and been very, very happy with them. I think they put out a good product.
What is the typical lab bill for from Gergen for one of these?
Yeah, the retail price on a Herbst is about $350. We have a special pricing with Koala that we're able to negotiate that down a lot, but we do a lot of work with them as well. But you can get them on the items. Normally, these are $350 on that item. The SomniMeds they can be up to $550, $600 on some of these. I've seen as high as $700 for an appliance. That can be an expensive item. So you got to look at those.
Is that the biggest producer of appliances, SomnoMed?
Boy, I think TAP, I don't know who has more of the market. TAP and SomniMed are probably, they both are big players. I'm not sure which one has the majority of it. They aggressively go after it. But they both have their certain problems. I believe that the Herbst appliance is your best appliance that's out there. One thing that we do is at Koala, I periodically do webinars, and I can give a lot of this. Some of the people in your speaking, if you guys want to come to my site, we can or email me. I'll let you know what our next webinar is, and I can give you a lot of this intro training in talking about what type of appliances is good to use. How do you get your bite? What labs would you use or not use? If we're having trouble in this area, how do we get out? A lot of these things. So So
what is your website?
Yeah, let me give you an email address to come to here.
Okay.
And if people want to email me, that would be good. But going to our website is good as well. But my email address is rod, R-O-D dot Willey, W-I-L-L-E-Y, at Koala Sleep Centers with an S, centers.com. Rod.Willey at Koala sleepcenters.com.
Another question someone's asking on Dental Town is she's young. She started working in this as an associate for an older dentist. This patient had a sleep study done 5 years ago. She's wanting to know, like I had to have my first colonoscopy at 50, and they said do it every 5 years. Do you just need one sleep study in your life? You either do it or don't, or is this something that you need to test every certain period of time?
Whenever there's medical changes and you're having struggles, you should have a sleep study done. That it may be that it's been 10 years and you're fine, you don't really need one. It might be it was done a year ago, but you've gained 50 pounds or you've lost 50 pounds or you've had a medical condition, you had a stroke recently, you've been diagnosed with Parkinson's. There's a lot of things that happen, so it really has to do more with condition than time on these sleep tests that are out there.
So you'd say if there's been a major change in their health history, then there could be a major change.
Absolutely, that's it.
In their sleep apnea. So you, the lab charges $350 for these. How much do you charge the consumer? How much is a case like this?
That is very interesting. It varies dramatically across the country. I know some dentists that are out there, they're saying, yeah, I'll do one of those. I'll charge you $800 here. Let me take an impression. I'm going to put one in the mouth and pat them on the back and send them on their way. But they're not following a medical model, and they're really not, they're doing the patient an injustice to not be doing this, because there's no way you can do it for $800, do it correctly, and make any money at it. You cannot do it for that. I've had others that are out there that I've heard that are charging $7,000 for the same thing, all the medical model. And the thing is they're charging the insurance company and coming back and getting a fairly good chunk sometimes, and some of them they may be getting $1,500 on it, but it is what it is, and there's legality issues on that as well. I'm going to say on the average out there, you're around the $4,000 range for that is a solid price on these. But it varies. It is all over the board, quite honestly.
I've only got you for 3 more minutes. We're at 57 minutes. I want you to finish with, there's a lot of confusion about sleep disorders, all this TMJ planes, the NTI. Some people say it caused the back teeth to super up. Talk about the treading between sleep apnea and TMJ.
65% of people with sleep apnea also have TMJ. The body's best way to fight off sleep apnea is clenching and grinding, which is a lot of night bruxism and a lot of the reason why people are waking up with such severe TMJ issues. So the body's best way to fight off sleep apnea is clenching and grinding. Your brain starts screaming at you, wake up, come on, you got to breathe here. And your first response is clench, clench, clench. No, 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 I don't want to wake up. No, no, no. Clenching, grind forward, take a breath. Pretty soon, clenching, grind forward, take a breath. You're doing this all night long, jamming up joints, wearing down the teeth, creating muscle fatigue and problems in that area. The other aspect we haven't even began to talk about here is temporomandibular joint disorder, TMD treatment, or TMJ, same stuff. Unfortunately, not taught by dental schools as well. I was always told those are the crazy people. They're not crazy at all. They're not hypochondriacs. They're in pain, and we need to be able to treat them. Come back and talk about that someday with you on how that's done and the philosophies with that. It works exceptionally well. It's more predictable, at least as predictable as sleep apnea for the treatment of this. So great thing to have on there. But the relationship, clenching and grinding to fight off sleep apnea, wearing down teeth, creating and jamming up joints, creating ear pain, jaw joints, headaches, stiff neck, limited opening, and all the rest.
I want to ask you a very specific question. If you just said 2 out of 3 people that grind their teeth have sleep apnea, would you go as far as saying that if any of your patients have TMD, TMJ, wear a night guard, that they should be screened with a sleep study?
It depends. It certainly should be screened. Now, whether it's with a sleep study or not depends on what the parameters are and what we have. There's a lot of signs and symptoms of sleep apnea. If they don't have any of those, you look down the throat, small tongue, good airway, no problems, then they likely don't have sleep apnea. If they're waking up a lot at night, they've got a lot of daytime tiredness, they're snoring, witness stopped breathing, for instance, high blood pressure. There's 1,000 different things that are in there that would warrant us to do that. It should be, I will make this statement. Everybody that we're looking for obstructive sleep apnea also, or for TMJ, also should be screened for sleep apnea. I didn't say with a sleep test, but evaluating these things, doing an Epworth test, There's ways of screening. And that would warrant then to do a official sleep test to find out.
Okay, we're at 60 minutes. Can I ask you an overtime question?
Absolutely.
A lot of confusion also is when these young doctors are talking to their patients and they're talking about sleep apnea, and they say they used to have all these issues, but they went to their physician and now they're taking a sleeping pill. What's the real common one that what's the one where you were taking it and getting up in the middle of the night and driving your car?
Oh, you're talking, yeah. Come on, what is it? I just drew a blank on it as well. I know exactly what you're talking about. You don't even know what you got on there and where you're going.
In fact, I just had a friend that was on that. Let me Google.
I'll think of it as soon as we hang up.
Sleeping pills that work. What's the name of that? Oh gosh, what are they?
Yeah.
Ambien. I just had a very good friend that was taking Ambien for sleeping, and he got up in the middle of the night and drove his car and he wrecked it and he died. And the only thing they found in his blood, there was no alcohol, drugs, there was nothing found in his blood except Ambien. But anyway, back to the question, do you think there's, when your patients, when you're looking in your mouth and you're thinking sleep apnea, but they say, oh yeah, I used to have problems sleeping, but now I'm on Ambien. Do you think Ambien could be masking it, or what is the correlation, or pharmaceuticals?
And quite honestly, it could be dangerous. Because of Ambien, or we have sleeping pills that's blocking out the brain from waking you up. If you're keeping in that deep sleep, you may be worsening your sleep apnea. If that oxygen level goes down far enough, you're either going to die from the sleep apnea, or it's going to make the heart work hard, and then you end up having a heart attack in the middle of the night. So sleeping pills, just because you're sleeping, because you can't get to sleep or you can't stay asleep, it can actually be dangerous when you have sleep apnea. And I'm actually surprised there's not more of that goes on. But Ambien, it's blocking out the awareness, but it's not correcting an apnea problem. In fact, it could be making it worse.
Well, hey, that was one of the fastest hours I've ever done in a podcast. I think you're an amazing man. But gosh, in Phoenix, next time you're in Phoenix, you're here a couple times a year, sounds like. You get the other ones. We could all meet at Dental Town, or we could meet at my house, or we could meet at the American Academy of Breathing and Sleep Disorders in Scottsdale, whatever. But it's been an enjoyable hour. Thank you so much for coming on today and talking to all my homies about obstructive sleep apnea.
And I'll give you a call here, and we'll get something set up. Maybe we can meet when I'm out there. I will say one more thing very quickly. If some of you would be interested possibly in talking to me more about Koala, we do all of the training. We've had people that didn't even know what the word apnea meant, and we'll take them completely through all the training. So we have quite a comprehensive program. Happy to talk to anybody along the way.
One last thing I'll throw at you is we started Dental Town 6 years before Facebook. It was in 1998. We got 250,000 dentists on there. When Jobs came out with the iPhone, we put out the app. And now 50,000 of those 250,000 dentists are on the app. And we put the online CE there. We put up 350 courses, and they've been viewed over 750,000 times.
Wow.
So I'm sure you've got a ton of material. You might want to create an online course and on sleep apnea. I think it would, you and I, we go to conventions and sit in brick buildings, and the millennials lay on their couch and watch it on their iPad.
Exactly.
And so it's a different world out there. So again, Rod, thank you so much for coming on my show. It was just amazing, and I can't wait to see you again.